everyone, I'm Maria Cristina Managoy and welcome to my video presentation. In this video presentation, I will discuss to you the 8 health teachings about the baby and mother care. Okay, the first one is the immunizations of the baby. The BCG prevent host or the Bacillus calmette-guerin. Vaccine is used to prevent tuberculosis. The BCG vaccine is named after Dr. Albert Calmette and Dr. Camille Guerin, who developed the vaccine from a germ called Mycobacterium bovis, which is similar to TB. What does the BCG vaccine do? The BCG vaccine does not prevent someone being infected with the bacteria that causes TB, but it prevents the development of the disease. It is specifically designed to prevent TB in children. It is very effective in preventing severe TB in young infants and can be given from birth onwards. How is it given? The BCG vaccine is given by an injection just under the skin, usually on the upper left arm. Sometimes, a test may need to be done before receiving the BCG vaccine. If there is a chance your child has already been infected with TB, the doctor will arrange for a TB skin test or Mantoux test. If the skin test is positive, that is, your child may have previously been infected with TB. The BCG vaccine should not be given if the skin test is negative. Your child will be able to receive the BCG vaccine. Okay, what would get the BCG vaccine? Children, particularly those under 5 years of age, who are traveling to countries with a high rate of TB infections. Aboriginal and Torres Straits Islander babies in areas where there is a high incidence of TB. Babies whose parents and or carriers have TB, who shouldn't get the BCG vaccine. Some children should not get the BCG vaccine because the vaccine could cause complications. This includes those who have had TB before, have a positive Mantoux skin test, have HIV infection, have a condition or take medicines that weaken their immune system. What to expect after the BCG vaccination? The reactions to vaccines is also called vaccine side effects, sometimes occur. The usual reaction to BCG vaccination is redness and or a small lump at the injection site, followed by a small ulcer, an open sore, or a few weeks later. The ulcer is usually less than a centimeter in diameter and may last from a few weeks to a few months before healing to a small flat scar. Next is the hepatitis B vaccine. The hepatitis B vaccine recombinant is used to prevent infection by the hepatitis B virus. The vaccine works by causing your body to produce its own protection antibodies against the disease. Hepatitis B vaccine recombinant is made without any human blood or blood products or any other substances of human origin. It cannot give you the hepatitis B virus or HBV or the human immunodeficiency virus, HIV. The HBV infection is a major cause of serious liver diseases such as hepatitis and cirrhosis, and a type of liver cancer called primary hepatocellular carcinoma. Pregnant women who have hepatitis B infection or are carriers of hepatitis B virus can give the disease to their babies when they are born. These babies often suffer serious long-term illnesses from the disease. The immunizations against hepatitis B disease is recommended for all newborn babies, infants, children, and adolescents up to 19 years of age. It is also recommended for adults who live in areas that have a high rate of hepatitis B disease or who may be at increased risk of infection from hepatitis B virus. These adults include sexually active homosexual and bisexual males, including those with HIV infection. Sexually active heterosexual persons with multiple partners. Persons who may be exposed to the virus by means of blood products, or human bites such as healthcare workers, employees, and medical facilities. Patients and staff of live-in facilities and daycare programs for the developmentally disabled, morticians and embalmers, police and fire department personnel, and military personnel. Persons who have kidney disease or who undergo blood dialysis for kidney disease. Persons with blood clotting disorders who receive transfusion of clotting factor concentrates. Household and sexual contacts of HBV carriers. Persons in areas with high risk of HBV infection in the population, such as Alaskan Eskimos, Pacific Islanders, Haitian and Indo-Chinese immigrants, and refugees from areas that have a high rate of hepatitis B disease. Persons accepting orphans or adoptees from these areas and travelers to these areas. Persons who use illegal injection drugs. Prisoners, the vaccine is available only from your doctor or other authorized healthcare professional. Okay, the next one is cord care of the baby. Put nothing on the stamp, no application, alcohol, no betaline solution. And do not use abdominal binder or varicose. No medical advantages. The Big Kiss has been around for centuries, not only in our country but around the world as well. It is known as the belly binder in the US and designer label, which specializes in baby binders, has in fact already come out with its version. The purpose of the Big Kiss, according to our elders, is varied. It is said that baby's tummy will be flat and sexy as she grows up if the Big Kiss is wrapped around the abdomen tightly. It could also be in the same concept as the traditional kaya neck rings to make the neck appear elongated, or the tiny shoes of the Chinese to maintain small feet. However, in our case, we don't know that the size of a person's midsection is determined by diet and exercise, or the lack of it. It has also been said that the wrapping a Big Kiss around baby belly will help baby achieve a perfect ini or pusod, as opposed to the outy appearance where the navel is protruding. In some cases, a coin is also placed on a navel before the Big Kiss is wrapped around the waist in the belief that it will hold the abdominal contents, and there is actually a medical explanation for this. It is common for a newborn to have weak abdominal muscles, as well as abdominal muscles that are not fused in the center, the umbilical region. Hence the abdominal or umbilical hernia. These muscles normally grow in the strength and size in 3 to 4 years, allowing the muscles to fuse and the hernia or the hole to close. If you are concerned about your baby having an umbilical hernia, consult your pediatrician. As for the ini or outy pusod, you only need to look at your own. Most likely your baby's pusod will look the same too. Elders have also said that the Big Kiss will help prevent kabag, also known as colic. Still others will say that the abdominal binder will keep baby's tummy warm. While it is common practice to rub something warm like aceite de manzanilla on baby's abdomen, or placing warm water bags supposedly to prevent kabag. Keep in the mind that some of these things might cause allergies or even burns. It is also not necessary to keep baby's tummy warm to prevent kabag. The simplest and most surefire way is to burp baby between and after feedings. The next is exclusive breastfeeding. The first 6 months, no solid food and no water. Children initiate breastfeeding within the first hour of birth and exclusively breastfeed for the first 6 months of life, meaning no other foods or liquids are provided, including water. Infants should be breastfed on demand, that is as often as the child wants day and night. Okay, the next one is the personal hygiene of the mother. The personal hygiene of the mother is gently pat dry with clean toilet paper or clean wipes. Change the sanitary pad after every void or bowel movement, or at least 4 times a day. Both lochia and feces are a medium for bacteria. If you have delivered vaginally, soaking in a bathtub can also help with cleaning and wound healing. Okay, the The next is the nutrition of the mother. For the nutrition of the mother, it is important to diet and exercise after pregnancy. And you eat healthy foods. Okay, like try to eat a balanced diet of fruit, vegetables, grains, protein foods, and dairy each day. Drink plenty of liquids. Your body needs a lot of liquid, about 6 to 10 glasses a day. Especially if you are breastfeeding, your baby drink mostly water, milk, and fruit juice. Eat foods that have a protein such as milk, cheese, yogurt, milk, fish, and beans. Protein-rich foods are important to help you recover from children and keep your body strong. If you are under 80 or were underweight prior to pregnancy, you need to eat more protein. Eat your fruits and vegetables. Try to make half your plate fruits and vegetables. Fruits and vegetables have vitamins and minerals that keep you healthy. They also have fiber, which helps prevent constipation. Make sure to wash fruits and vegetables under running cold water before eating them. Okay, lose weight safely. Talk to your doctor about safely losing your weight after your baby is born. Losing weight too quickly can affect your breast milk supply. Do not take diet pills. They contain harmful drugs that can be passed to your baby through breast milk. Remember, take prenatal vitamins if you are breastfeeding. It is a good idea to continue to take your prenatal vitamins. Your doctor can prescribe these pills so that your health insurance will cover a portion of the cost. And limit junk foods, soda pop, cookies, donuts, potato chips, etc. And avoid these foods when breastfeeding. These are some foods and other substances that can be harmful to both you and your baby if you are breastfeeding, like alcohol, wine coolers, beer drinks, etc. Caffeine. Caffeine is a stimulant that passes through breast milk to the baby and may affect growth. Caffeine is found in tea, coffee, chocolate, many soft drinks, and over-the-counter medicines. Okay. And you need to exercise after pregnancy. Exercise helps you lose the weight you gained during pregnancy, reduce backaches, constipation, and bloating, lifts your spirit and improves posture, helps build muscle tone and strength, promotes better sleep also. Once your doctor says it is okay to start exercising, there are many ways to be active. Walking is a great way to exercise because it puts very little stress on your body. Your baby will probably enjoy being walked in a stroller too. Try walking briskly for 20 to 30 minutes every day or at least 3 times per week. Okay. Correcting the myths of the postpartum mother. The trend of choosing natural birth at home without proper supervision is gaining more attention and popularity in some parts of the whole world. This is partly due to wrong beliefs of modern medical care. It prompts the need to explore further into other myths and wrong beliefs present in communities around the world surrounding pregnancy and childbirth that may lead to harmful consequences. A total of 25 literatures were selected and reviewed. The most reported and wrong belief is the eating behavior such as avoiding certain nutritious fruits besides eating saffron to produce fairer skinned babies, which in fact contains high doses of saffron that may lead to miscarriage. The most worrying myth, however, is that unregulated birth attendants such as doulas have the necessary knowledge and skill to manage complications in labor, which may well end up in perinatal or even maternal death. Other myths suggested that modern medical care such as vaginal examinations and baby's heart monitoring in labor as unnecessary. A well-enforced health education program by well-trained healthcare personnel besides sufficient number of antenatal care visits are needed to overcome those myths, wrong beliefs, and practices. In conclusion, potential harmful beliefs and practice in pregnancy and childbirth are still abound in today's communities, not just in least developed and developing countries but also in developed countries. Women and children are two very vulnerable groups. Therefore, debunking myths and eliminating harmful practices should be one of the healthcare provider priority, especially those in the primary care setting as they are the closest to the community. Okay, the next one is the resumption of sexual contact, no logia discharge, LAM up to 6 months, or intercourse after birth. Okay, remember, after the birth of a baby, most healthcare providers or HCPs advise waiting 6 full weeks before resuming vaginal intercourse. This is for 2 reasons: the possible need for healing of the vaginal or perineal and or abdominal tissues, and also for the theoretical risk of uterine infection. After a baby is born, the uterus has a fresh open wound as big as the placenta. This wound can be susceptible to bacteria introduced into the vagina via intercourse. The wound takes about 6 weeks to heal completely. Okay. There are many factors which will determine the best time to resume intercourse, whether it's at 6 weeks or earlier or later. Some of these are pain, healing of tissues, and libido. If you had a cesarean section or vaginal surgery, it might be extra important to wait the full 6 weeks in order for tissues to heal properly and to prevent tearing, infection, and pain. Some people resume before 6 weeks with no complications or adverse effects. A good rule of thumb is to wait for any bright red vaginal bleeding to cease. If you are unsure what is right for you or if it's safe to resume intercourse, ask your healthcare provider. Waiting longer than 6 weeks is, of course, completely up to you. For the family planning is having the desired number of children, and when you want to have them by using safe and effective modern methods, proper birth spacing is having children 3 to 5 years apart, which is best for the health of the mother, her child, and the family. Family planning provides many benefits to mother, children, father, and the family. Mother enables her to regain her health after delivery, gives enough time and opportunity to love and provide attention to her husband and children, gives more time for her family and own personal advancement. When suffering from an illness, gives enough time for treatment and recovery. For the children, healthy mothers produce healthy children, will get all the attention, security, love, care, all the care they deserve. And for the father, lightens the burden and responsibility in supporting his family, enables him to give his children their basic needs like food, shelter, education, and better future. Gives him time for his family and own personal advancement. When suffering from an illness, gives enough time for treatment and recovery. That's all.